Good day. My name is Michelle Levander. I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Disappearing Data and How Reporters Can Respond. We're here today to discuss the consequences of unprecedented changes to our nation's federal data collection and dissemination enterprise, and how these changes may compromise journalists' ability to report on the health and well-being of Americans. Since President Trump took office, some key data sets have gone missing, others have been altered, and our ability to learn about the health and well-being of populations going forward has been compromised by the firing of entire teams in charge of gathering and analyzing data on subjects ranging from mental health to addiction to pregnancy risks and childbirth. These developments make it harder for journalists to hold officials accountable for the success or failure of policy decisions drawing from the data, and policymakers, researchers, and health officials won't have critical tools to make urgent health policy decisions guided by data sets they've come to rely upon. But as we'll also discuss today, a crisis can present opportunities to rethink our flawed data infrastructure. For reporters, we'll hear about strategies to be creative and resourceful in this challenging moment in finding other ways to convey the scope and scale of the health issues we're tracking. Today, we have a robust and distinguished panel of data experts and data journalists ready to help us unpack these issues. Jarvis Chen is a social epidemiologist and senior lecturer on social and behavioral sciences at the Harvard T.H. Chan School of Public Health. His research focuses on structural inequities in health, with a special interest on racialized and socioeconomic disparities. He has an abiding interest in the role of responsible data stewardship in informing public health practice, evidence-based policymaking, and accountability of social institutions to the public good. Chen was one of the organizers of datathons at Harvard in January and March that focused on preserving data sets at risk of disappearing. I'd also like to introduce Julia Lane, Professor Emerita at the NYU Wagner Graduate School of Public Service. She was a senior advisor in the Office of the Federal CIO at the White House, supporting the implementation of the federal data strategy. She recently served on the Advisory Committee on Data for Evidence Building and National AI Research Resources Task Force, the Secretary of Labor's Workforce Innovation Advisory Committee, and the National Science Foundation's Advisory Committee on Cyber Infrastructure. Julia has founded or co-founded public health infrastructures, and she's currently working on the Democratizing Data Project and published the book Democratizing Our Data, a Manifesto with MIT Press in 2020. I'd also like to introduce Angel Castanis, data editor of the AP, where they oversee a team of data reporters who acquire, vet, and crunch numbers as part of the AP data team to uncover compelling, hard-hitting stories. Their work, some of which has garnered national awards for investigative reporting and led to lasting policy change, includes reporting on modern-day redlining, the lack of legal protections for transgender workers, and the demographics of frontline workers during the pandemic. They previously worked as a data analyst at the Williams Institute UCLA School of Law, a research center focused on sexual orientation and gender identity law and public policy. Emery Parker is the data editor at STAT. He joined STAT in 2021 after working as a digital editor and data journalist in Charleston, South Carolina. In 2015, he was part of the team that won the Pulitzer Prize for Public Service for a series on South Carolina's epidemic of criminal domestic violence. Prior to working in journalism, he worked in a neuroscience lab at the Medical University of South Carolina. This webinar is made possible thanks to the generous support of the Commonwealth Fund and the California Endowment. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format. We'll be hearing from our speakers first, and then we'll turn it over to you, our audience, for questions. Feel free to share general comments and questions in the Q&A panel in Zoom. And you can also write us there if you're experiencing technical issues. Now let's get underway. Jarvis, let's start with you. Can you kind of give us a landscape of the current state of data preservation efforts and what categories of data are most at risk?
Yes, first of all, thank you very much for inviting me to be part of this panel. So I think one of the things to think about is that these attacks on data, the availability of data, have to be seen within the larger context of attacks on science and on evidence-based policymaking more broadly. I think that for many of us who work in public health and related public areas, the attacks on data, the sort of blitzkrieg of the removal of data took us all a little bit by surprise. And so many grassroots efforts came about earlier this year to try to preserve data. And I think that's a positive that we've seen so many organizations and individuals step forward to try to back up data, find ways to restore data that had gone missing. And then we also know, as a result of litigation, that many data sets and data sources have come back. And so along with that has come a kind of decentralization of data that presents an opportunity to think about the democratization of data and this idea that many copies keeps things safe, and all of those are positives. At the same time, I think we're really worried about what the future of many of the federally collected, federally curated data sources are. For example, a recent Lancet letter looked at an analysis of about 232 federal data sets that had been modified between January and March of this year, and finding well over half of them had major changes to them, many of them to remove information about diverse gender identities, sexual orientation, things that are quote unquote not in line with the priorities of the current administration. And this brings up questions of how is it that we can safeguard decision making about what data are collected that are based on real scientific consensus and make them robust to political agendas and ideologies. I'm both positive about the kind of decentralized efforts, the citizen data rescue efforts that have happened, but also really worried about, there are some kinds of data that can only be collected by the federal government, and also this issue of trust. We trust, we have in the past trusted, and we can discuss whether those trusts were warranted or not, but trusted the federal government and the scientists who collect these data to curate and preserve these data in a form that is able to be analyzed and trusted. But now that that trust is in many ways broken, I think the big question for our society is what do we do moving forward in terms of ensuring the availability of data, and also to really make visible what it is about these data that are so important to preserving the public good. For example, essentialdata.us, the America's Essential Data website, is collecting many of the narratives about how actual people are affected by the disappearance of these data. And I think that's one of the important things that journalists can do, is really make visible this thing. In public health, we often talk about how public health has a little bit of a PR problem in that when public health works well, we don't see it working well. And it's only when public health is endangered that we really see, why do we need prevention? Why do we need data, robust data systems and data collection? And so I think this task of making visible what is at stake is really important.
Thank you. And Jarvis, a follow-up question. Your research focuses on structural inequities in health. And how do you see these changes that you've been sharing with us impacting your ability and that of many others to understand the progress being made in their communities in reducing structural barriers to health and well-being?
Yeah, so I mean, one of the most important things to be able to act on structural inequities in health and to intervene to make health better is to document that it's happening. So, when we have politically, ideologically motivated sort of impetus to remove these data, it doesn't remove the fact that these inequities exist. It just makes them harder to see. I wanted to give kind of some specific examples. So one great example is the CDC's youth risk behavior surveillance system, which many of us saw early in January was just completely removed from the CDC website. It's one of the sources of data that gives us information, particularly for young people, for adolescents, about diverse gender identities and diverse sexual identities. That data set was removed. Then it's come back, partly because of litigation, but it's come back with particular elements removed. Um, in looking at it, it looks like the transgender identity question, which became part of the federal uh, version of the survey, became part of that required to be collected by all states in 2023. It is still technically in the federal module, the federal survey module, but the CDC has made it clear that they may not report out that data. So, we only have one time point now for the whole country, 2023, of reporting those data. The fact that we now won't be able to look at those data moving forward doesn't mean that the unequal health outcomes experienced by gender and sexual identity diverse adolescents are not being experienced. It just means that we won't be able to see them. Another example is the PRAMS data set, which is a data set of maternal and child outcomes. That data set has been put on hiatus, put on hold, and also importantly won't be so part of the process of publishing for external researchers to publish from PRAMS is that they get the manuscripts approved by the CDC. But because the entire PRAMS workforce has been let go, there is no process now for researchers to get those manuscripts approved. And the future of those data in terms of their availability to researchers is really in question. Again, ostensibly, this putting it on hiatus is because of quote unquote unspecified DEI concerns in this data set that reports on maternal and child outcomes. But it's one of the major data sets that give us information on the health of pregnant people and birthing people. And now we don't have that.
Yeah, and Jarvis, one more big framing question for you before we turn to one of our journalist panelists, which is as we think about data preservation and stewardship, how does that fit into the broader context of government support for science and evidence-based policymaking, and where does that leave us?
Yeah, so, a parallel uh, to the data concerns are, for example, concerns about, for example, the vaccine advisory panels and this idea that our federal government has, prior to this year, relied on the expertise of scientists, and not just like individual scientists with like particular ideological viewpoints, but a well-developed structure of peer review, of bringing together scientists to develop scientific consensus, for there to be kind of firewalls or sort of structures that make sure that experts are able to give their scientific opinions and have those count towards policymaking without undue political influence. Now we're seeing the erosion of those norms when it comes to grant review, when it comes to vaccine recommendations, and when it comes to data. And that's a real concern. And I think that though litigation is going on, challenging many of those things as arbitrary and capricious under the Administrative Procedures Act, litigation unfortunately tends to be a bit slow in being able to stem this tide. And one of the big concerns I know across many of our fields is that all of this will be dismantled before we can get kind of injunctive relief, and then as a result, putting the egg back together after it's been cracked becomes very difficult.
Thank you. Thank you so much, Jarvis. We're going to turn now to Emery, the data editor at STAT, for a journalism perspective. And you were one of those people, Emery, who was frantically downloading CDC data in the early days of the Trump administration. Give us a sense of the current state of missing and censored data and what you've seen so far.
Sure, yeah. I think to start off with, kind of echoing some of what Jarvis was saying. I think in the big picture, um, archival efforts were already pretty good even before the current administration came into office. So I think like one bit of like good news there is that if it existed on the internet, if it was publicly available before January 20th, it is probably somewhere. You can probably find it. Um, but I think to give people a sense of what I've been seeing, it might make sense to take a quick look at that effort and specifically what I've been monitoring just at the CDC. Um, so, uh, oops. Yeah, so this kind of got started at the end of January. These rumors started going out. This is a screenshot just from Reddit, but these weren't just random rumors. I was hearing this from sources, and colleagues of mine were hearing this from sources as well. But the thinking was that the HHS had received these executive orders that required them to go through and remove a lot of information from their sites that have to do with what the administration calls like gender ideology, among other things. And the concern was that they were not going to, that this executive order set a deadline. They were not going to be able to meet that deadline. And the rumor was that they had interpreted the terms of that executive order to mean that if they could not meet the deadline, that they had to take everything down, like literally shut down every HHS website, like every website that's part of their domain and or that they're responsible for. So that obviously reflects sort of like an apocalyptic situation. And like you said, I, along with tons and tons of people, kind of panicked at that moment. And I was, again, one of the people that began an effort to make sure that we had our own archive of this data. Um, so at the CDC, it's not a ton of data compared to some of the other agencies. Like this is much smaller, for example, than like what the Census Department has available, but it's still pretty substantial. There's about 1,500 data sets that you know rises up to about 111 gigabytes of data. So I was able to use the CDC's API to download all of that. I wrote a ton of code to compare these files and figure out what's actually missing. And then we did end up putting making our archive available on our website. But I think what's more interesting than just, again, like I said, having the backup, because this isn't like STAT is not the only source of a backup of CDC data that you could possibly find, but um, what I've been focusing a lot more on is sort of monitoring what's going on, right? So as of now, there's been about 146 data set, or exactly 146 data sets removed from the CDC site. Um, and again, that's coming from a baseline of about 1,400, 1,500 data sets from before, from like last year. And so yeah, so I've been taking like a sort of a specific like look at the like every single change that's happening too. So it's not just looking at what's been deleted, but also taking a look at how things are being changed over time. And this is a really good example of again what Jarvis was talking about, where a lot of the sort of changes that we're seeing have to do with in this case uh, this is a data set having to do with heart disease mortality, and you see there's about 56 or 59,000 rows in it, and they've just gone through and replaced this one column where it used to say gender and replace that with the word sex. And that's sort of typical of what we've been seeing, or at least what I've been seeing. And again, putting that number into perspective. Oh, and if you're interested in taking a look, here's a little plug for our project. But putting that into perspective again, so there's about 146 data sets removed out of about 1,500. So that's not like the majority, right? But again, as Jarvis was mentioning, some of these data sets are pretty high impact, right? Some of the ones that he was mentioning, like the Youth Behavioral Risk Factor Survey or PRAMs. And then, some of the other things that I've been sort of monitoring are there's the US CDI, the standard, which is basically a system for defining all the like data classes and elements that get used in like things like electronic health records or in surveys. And there's a proposal for example, in that to remove the fields that would have to do with things like gender identity or sexual orientation. And so again, I think the big picture is, like I said, I think a lot of things are already backed up. So the concern is really has more to do with the censorship of data, but also what comes next, right?
Yeah, and just to follow up on that, you've done this, you and others have done a pretty heroic effort when it comes to preservation, but what more do we need to be doing?
Yeah, so like I was saying, I think a lot of effort has gone into preserving data, and that was my first instinct was, we just need to download this stuff and preserve it. I think we've accomplished that for the most part. And I think moving forward, the real gap I see is in tracking of data, right? Because I think the real concern is so obviously, I mentioned there was this rumor going around that HHS was going to basically delete their entire site. That ended up not happening, thankfully. But I think the broad concern remains that something like that could happen in the future, or I think also really specifically, there's a lot of concerns about sort of data manipulation. Maybe even the idea that agencies start sort of cooking the books, so to speak. And I think the problem is that we need to have a lot of eyes on a lot of data to know how things are changing and to be proactively monitoring, when these things are happening, and also sort of giving ourselves tools like these can give ourselves sort of a sanity check too, because these websites, they do maintenance too, right? And so that's been a thing I've seen like on social media is, like the CDC will do some maintenance on their site and something might become temporarily unavailable. And a lot of people immediately freak out in this environment thinking, is this gone forever? And having an automated system for monitoring this and having that sort of understanding lets you sort of step back and understand, okay, is this how alarming is this basically, and so if I could do anything, it would be to encourage more people to stand up more of these like tracking efforts, because obviously I'm only focused at this point on CDC data, but I think there's a lot of other federal data sets that we need to have a lot more visibility on.
Thank you, Emery. And I want to turn now to Julia and just kind of take a moment to think about a reporter who isn't a data expert like Emery or Angel and who's on a deadline and just wanting to try to navigate these trust issues about these data sets. What recommendations do you have for reporters interested in knowing whether they can trust a given data source in their work?
Yeah, so a couple of things. I think in some ways, this whole issue has brought to a head something that I raised in my book, that said, we've been talking about trust. There has always been the sense that you could trust federal data. And I guess after many years of working with federal data, the quality has seriously been degraded over the past many years. Many of them are developing, at least in my field, labor. They're using concepts that are close to 100 years old, like the GDP measure, the gross domestic product measure, was developed for Herbert Hoover in the Great Depression in the 1930s. Unemployment rate measure, the measures of employment that are still being reported reflect employment as employed 1 hour a week in paid work during the survey month. They're using data collection methods that are 50 years old. And so I think, surveys, I mean, how many of you pick up the phone when it's from an unknown number? So I think in some sense, what we should be thinking of is what are the concepts we're trying to measure? And how can we certify the plumbing? So that's what you're talking about, Michelle, which is what kind of standards could be associated with it from both the user point of view and the producer point of view. And think about this as a firestorm that went through and what the alternative approaches are, which may not include the federal government or may look at the federal government as an alternative source. So, pardon me. So let's take a step back. And what I'd encourage reporters to think about is not automatically go to the federal government to say, what's the measure of employment or unemployment? What's the measure of AI? What's the measure of whatever you want to look at? What they're really interested in doing is something that is sound and usable by scientists and the public. And so what you're talking about with trust is the plumbing right? Is the process that generated those numbers right? And so when you talk about trust, you're talking about things like Underwriters Lab seal of approval. And the federal system isn't necessarily the way to get there. Let me give you an example. People are worried right now about the impact of AI on the workforce. The Census Bureau issues a 52-page survey, and they ask a single respondent in a firm to answer this question. So you've got 1,000 people in a firm, and you've got one person having to say, what's the effect of this business's use on artificial intelligence technology on your workforce for each of the following? And that person has to answer these questions. Out of that survey, Census says, oh, only about 5% of the firms are using AI. I would suspect a big reason is the respondent skipped that answer. So instead of thinking about the federal system as being an indicator of trust, let's go back to think about what are we trying to measure, what's the sparkly fountain, and how are we going to develop those trust rubrics. Now, here's an example. Here's a reporter, Paul Fain, who's an expert in this area. And here's what he did. So we're talking about reporters. The Burning Glass Institute put out a credential value index and says, oh, you can use this, governors and reporters, to report on the impact of credentials. He went and did some back checking, and experts, so think back to the credentialing issue, experts said, you really can't trust these measures. There might be self-selection. There's no benchmarking against other studies. I don't know what the methodology is. So essentially what he's doing is he's going and doing the backwater testing to see, can I do that? Now, you asked, how are we going to get around that, given that you're under deadline? What are you going to do? One of the things that you might want to think about is in many, many states, almost all of the states, you've got experts in particular areas, labor markets, education, the measurement. So the states have been getting together and developing new products. You know, your Chief Justice 150 years ago, Louis Brandeis, said states are the laboratories of democracy. So think about a new ecosystem. You've had a forest fire going through. Not sure that it was all bad, because what it does is it's forcing us to rethink what we're doing. What's our sparkly fountain and what does our plumbing look like? And think about new ideas and new ways of measuring these new concepts using the massive amount of data that's available. So go back and think about, rather than a few people in Washington developing the measures and then promulgating them, you know, as kind of coming down from the mountaintop, build from the community up. The states right now, there's subject matter experts who will tell you whether it makes sense or not. But you could imagine developing community-driven trusted data standards that measure fitness for purpose as well as fitness in the production. So both the user and the producer value proposition. And put it into tools. We're working with Harvard Dataverse, for example, on this, but this is a project we'll work on. There's a whole bunch of trusted data approaches like ML Commons, Croissant. Feed it into platforms where you've got a trust signal. So instead of having to go and answer all those questions yourself, like Paul Fain did, that you can develop those signals from the states or from whoever the expert is, like Jarvis and Emery.
Yeah, and Julia, this is obviously an effort that's been going on for some years, predating some of the changes we're talking about today, but are there other steps that you would want to share with us about building a better and more trusted data ecosystem? And I seem to recall that you had shared with us before a link to a repository that had a lot of information as well, and that might be useful. If that doesn't come,
it doesn't come immediately to mind,
no
but
worries. No
yeah.
worries. But just
Sorry.
this idea of rethinking how we do things. Was there anything else you wanted to share with us?
Well, I noticed there was a comment in the chat. Do we really need the federal government? And I think maybe 100 years ago, that's where the expertise was hosted. But now so many people are becoming more and more skilled in data science, making sense of data. And so it can be pushed down and you can answer questions much more efficiently at the local level. So that's where I would head.
Yeah, okay. Thank you. And I'm going to turn now to Angel and just ask if you could really share with us a little more, just diving back into this idea of the ordinary reporter who's not in the same league as a data editor like you or like Emery, you know, just when it comes to within AP, this, you know, vast news gathering organization, how are these data challenges affecting the day-to-day work of those reporters? How is it affecting you and your data team? And what are you suggesting for both of those kind of levels of reporters in how to manage the situation and still do credible reporting?
Hi, everybody, first. I did want to thank you, Michelle, for including me on the panel. So I think one of the things that I wanted to bring up first is that when public data disappears, communities and people's lived experience disappear with it, right? That's what we're all afraid of. That's the core danger. And journalism is about helping people understand the world, and the stories grounded in real human experiences is what I think the most effective way to do that. And the data really lets us show and report how widespread that experience is, right? So we're talking about, you know, we're talking about numbers and what numbers are missing, but I really wanted to bring it back to, you know, who's impacted and and what we cannot do if the data goes missing. So on my team, we strive to use data to tell stories that are not being told. Oftentimes, those are stories about underrepresented groups like LGBTQ people, Native communities, immigrants, people of color, and others often left out of official records. And so when data sets go dark or become distorted, it's not just a technical problem. It's a threat to visibility. It's a threat to accountability. It's a threat to protecting communities and the ability for policymakers to make informed decisions. And I know everybody on this call probably already knows that, but I did want to talk about how this isn't new. Long before this moment, we've worked around data gaps in reporting on marginalized communities. There's been, several gaps in data that we've had to figure out how to report around before. And so as a former researcher, I worked on data for LGBTQ populations and these are groups that were almost always missing from big data sets. And the lesson that I learned there was you can't just wait for perfect data. And now when the data is becoming even more imperfect, you need to get creative. You need to pair what's available with community insight. You crowdsource, you listen deeply to communities and to researchers and to policymakers and to you listen to figure out what's going on, because if you don't report on these, even with the data missing, people assume the issues you are aiming to report don't exist, right? So first, I would really encourage reporters to remember what the stakes are. If a data set's missing or it's hard to find, don't move your gaze from that story. Still try to hunt down who you can talk to tell the story. One other tip I would give reporters in this situation is to really emphasize transparency. That's something that I tell my team all the time. We really keep transparency in data analysis. So when we actually do our math and our coding, we like to have a record of everything we do. But for a reporter that is not a data reporter, that's important to kind of show the work or explain caveats within the story. So that's a way to talk about the data that might have been changed or that might be hard to find, and talk about the imperfections in the story. And it gives people a sense of, we might not have been able to tell the trend over 5 years because, X, Y, and Z. We've gotten used to talking about how a lot of the data sets were imperfect after COVID, right? So in stories, I think people, it's a common occurrence where, the data, had a blip in 2020, 2021, and, we explain that in the text, right? Or in the copy. So I think being transparent on the imperfections of the data or what has changed or anything that comes up is important. And then the other tip I would have would be to think of data as a source, not as a kind of, something that you can interrogate. I recommend you interrogate it, you verify it, you hold it accountable. And this is something we always have done. We've never really taken it for face value because, there's all types of systems enshrined in the data that already is set up, social systems that are kind of enshrined in data. So I think that mindset of kind of knowing that the data is not perfect and that some people and some realities will be invisible if we don't go actively looking for them. If there is no data, that doesn't mean there's no story. And so that's something that I would kind of highlight.
Thank you, Angel. And I wanted to ask you, just as you look at AP for your data team and also for just broadly reporters, how often are you bumping up against these data gaps? And maybe provide an example of two of some of these creative workarounds that you're using to contend with the moment.
Yeah, I think right now the challenge is shifting. In some cases, the data exists, but it's harder to find. In some cases, it comes with like a warning label or it lacks updates, right? So another thing we're seeing is that the update might not be comparable to the past data. And then there's other cases where it just doesn't get released. And our team is already feeling that. So for example, one of our reporters was trying to cover the Trump administration's freeze on education grants. And the, let me make sure I get this right. The National Center of Education Statistics, NCES, yes, hadn't published the latest figures, but there was more current data that was released on the census website. So it wasn't, it was still released, but it was kind of buried and it was hidden. And so, we only found out about that after talking to our sources and making sure that we checked all the boxes because it wasn't up and we didn't want to obviously report that it just wasn't up. And so we were really went and talked to a bunch of sources to figure out where it was released. And so it wasn't gone, it was just buried. But that did affect our reporters' ability to cover that story in the moment. Another case is, this is also education related. So the NAEP science scores, so that's the National Assessment of Education Progress. Those assessments measure student performance in science. Those were supposed to be released this summer, and they just weren't. And then in that case, that really affected our ability to report it because for this data set, there's no way to go directly to the states. There's no way to get around that it's a federal data set. So in that case, that's kind of a waiting game to be able to see if that's going to be released. And then the third example is, and Emery, I'm not sure if I don't think you mentioned the social vulnerability index, but the CDC has a data set called the Social Vulnerability Index. It's used by public health and emergency planners to identify communities at risk. It was taken offline, and then I believe it was restored by a court order. And in that case, that data set is an index that uses census data to you combine it in different ways to make up this index. So if that data set goes away, it can be recreated. So that's another tool or method that we've used, right? To try to recreate data sets that might not exist because we know the methodology from past documentation. So we've been getting creative. We've been verifying federal data with more local sources. We've reached out to academics. We've used FOIAs where possible. And in some cases, we actually have people coming to us. So trying to give us data because they're worried that it's not going to get out. So we're at a weird moment where we're seeing both silence, but then also urgency. And if I could, there's another dimension to this that I wanted to mention that is really alarming to me, and that's data misuse. So too much data and not too much data, data being connected from across the federal government into one giant data set, or simply data misuse. It's not just about disappearing data. Some data sets are being weaponized, which is also not new. So if you want to take the recent lawsuit where states are pushing back on federal attempts to collect personal data from SNAP recipients, or another example, the crossover of student visa data with traffic incident or policing data that happened in the spring. If people think their data will be used to punish them, they may stop engaging with the system entirely. and then the data truly vanishes, right? And in that case, we lean on questions that I've always thought were the most important, which is not only asking, is this accurate, but also why is it collected and who benefits from it? In the end, as always, I think data ethics and editorial judgment are just as important as the technical skills. So even if you don't have the data technical skills, I think that's okay. The key isn't knowing R and code and all that. It's knowing how to ask good questions. Like, where did the data come from? Has it changed? Who might be impacted? And that's what our reporters do. Our reporters are data reporters, but they're reporters first. So they really go in to try to find if the data is released somewhere else, if it can be combined and or generated in another way, or in some cases, we're calling all the universities to see how many student visas have been revoked, right? Where we generate our own data set. So that's how we've adapted.
So, Angel, you've given a number of suggestions here, all very valuable. I just want to drill down on maybe one or two of these and ask Emery too, as a journalist, if he wants to weigh in as well. But if I thought it was pretty nifty to see, Emery, your slide where you could see, gender replacing, I'm sorry, sex replacing gender and so on. But that implies a very detailed knowledge of these things that the average reporter wouldn't have. And also, I think people are just really accustomed to going, quickly getting the information they need for the paragraph in their story and moving on. And so I think it's hard for the average person who doesn't have also like the infrastructure of a data team in their newsroom. So, I mean, who should they make their new friends? And what level of rigor do you think is necessary to just like not trip over all this stuff?
Yeah, I can
Yeah.
add
Oh,
I could add
go
a
ahead.
couple sentences, and then Emery, you can take it away. I just wanted to continue with something that I mentioned before. I think leaning on your sources and making sure that you have, folks that are very knowledgeable of a specific data set that you might work with all the time, just having them on call. It could be people that used to work in the federal government. They often are particularly helpful, or researchers that have used the data kind of, nonstop on their niche research topic, and just having them available so that you can, especially if you have a beat, just figuring out the sources that you can lean on to identify changes, because you're not going to find them in the data if you're not, you have other things to do in your daily work. It's going to be hard, but really kind of leaning on folks that you can kind of call up.
If I could just jump in there, 100%. I mean, that's your stand-in for a trust rubric. That's, yep.
Yeah, and so my thinking there is again, going back to what I was talking about with the CDC data backup, right? So when I archived all of the data, that was based on the idea that I was afraid that HHS was going to delete everything. And then they didn't delete everything. And it turned out what they were doing was deleting things in a very piecemeal way or censoring things. And I realized just having that archive itself isn't super useful, right? I mean, like it's useful in its own right, but that's what was actually what I actually needed to be doing, and what was actually more useful was tracking and figuring out what are those small incremental changes. And I think like this is sort of become my cause, right? Is I think that is so like you're right. Like a lot of reporters and a lot of people in the public do not necessarily have the knowledge or skill set or resources to be doing that for themselves. I have done that for CDC data, right? And I think that this is important work that those of us like on the data side of news and people with this skill set, like I said, in my perfect world, I would be I mean, I am encouraging like everyone who can do this sort of stand up this sort of tracking effort to do that, because like that would be the ideal solution, right? Is that like a reporter shouldn't have to do that work themselves. Ideally, like somebody like me or Angel or anybody at, it doesn't even have to be in journalism, right? That these sorts of resources would just exist, and these are the sorts of things that ideally we need to be building.
Thank you. And Julia, you wanted to add something, and then I'll ask one more question of everybody, and then I'm going to just turn to our audience and any questions you have. So please feel free to put that in the Q&A if you haven't done so already. Yes, Julia.
So I'm going to make an impassioned plea here, as you probably gathered. If there are particular data set or questions, if there are particular problems, sparkly fountains that are of key interest, then build a community that has the expertise both on the use and on the production of these data, and figure out how to develop community-driven standards. It's been done in a zillion other areas, like building LEED buildings, for example. That's not produced, that certification is not produced by the federal government. It's out of a need and out of a community. And I think that's going to be much more trustworthy than the current state of affairs. And I know we're pushing on US data, but in the UK, a lot of federal statistics are failing. So it's a systemic issue that I think needs a ecosystem rethinking. And I'd love to see other efforts in this area take root and grow.
Thank you. Thank you. And Jarvis, were you going to add something too?
Yeah, I just wanted to pick up on this idea of sort of communication and more building of community around these things. One of the things that happened for us in our datathons that we hosted here at Harvard, and that was a purely grassroots activity that just a number of us who are concerned about this put together, is that, at the time, as Emery was saying, it almost felt like possibly all of the websites and information would disappear. And what we did was we kind of crowdsourced, brought together people to just be together in person on Zoom to try to document as much as we could, search for what we could. But one of the things we realized is that almost inadvertently in doing this, we had brought together subject matter experts. We had recruited people not just from our institution, but from across different institutions, in departments of public health, in academic organizations, to highlight what was important to them and to begin to kind of identify particular areas of concern that we needed to focus on. And that kind of grassroots data, democratic data initiative, I think, is really important to this. There are information, I think, that is going to be hard to create decentralized kind of citizen data for, like, for example, health data is really sensitive. It's very difficult for non-governmental agencies to have the trust to be able to be the ones who are assembling and curating that. Although, as Julia pointed out, there are things that states can do to band together. I think one of the problems is that then you're going to have states that are committed to health equity, who are making their information available, creating data standards and protections, and others who are just refusing to participate, which will create a patchwork. But at least this kind of idea of coming together, building solidarity, building robust data structures, I think is like one of the most important things. And this communication across academics, across scientists, across citizens and communities and journalists and reporters, I think those platforms for communication become really important at times like this.
Thank you so much. My last question to Emery and Angel is about FOIAs and Public Records Act requests to the federal government. And if they've laid off the whole department, is there anyone answering the phone, and how are you handling that?
I think there's a couple changes that we've noticed. So oftentimes when administrations shift, there's a little lag, right? Like it gets a little harder to FOIA things because people are switching over sometimes. And in this case, I think that has been exacerbated. I think there are certain departments that might provide data because they want the data out there. So think of, immigration data being put up on X daily, right, for that short amount of time. So we might get responses for certain data very quickly, and we might kind of see challenges to the FOIA requests, so we'd have to appeal. And as I mentioned before, we've also had folks reach out to us with data sets that they think are important, that they might be worried are not going to be updated. And that's before we even FOIA for them. So, but yeah, we've seen a little bit of everything.
Yeah, I'll just echo what Angel said. It's been pretty much the same experience for me. It's hard to fully say, right? Like the FOIAs had never been perfect. It's not like every previous administration was just like, handling every single request immediately, promptly, and perfectly. But there definitely have been cases where it's taken longer to get a response, or you've encountered like more resistance than you might have expected in the past. But I think my experience has been basically the same as Angel's.
So let's just turn to some of the questions that we have in the Q&A, and we can stay for another 15 minutes just to get through as many of these as we can. One of them is a pretty big question from Susan Strank, who asks, what data can only be collected by the federal government? And, any of you may feel free to reply to that.
As I was sort of trying to get at earlier, I think health data is one of the ones that we have to be really thoughtful of, because there are health data that are collected routinely by states at the state level in vital statistics registries and disease registry systems. But for those data to be collected, there has to be a sense of trust. And then also for the federal government to then compile them and make them available, those relationships between the states and the federal government, like going back 100 years, are very key to being able to compile those. If the federal government is no longer a trusted partner in being able to curate those, then we need to think about what other systems are available to do that. I will also say there are a lot of data that are, that, for example, the Census Bureau collects, that the IRS collects, et cetera. There are a lot of very heavy data protections in place, although some of those data can be made available to researchers. But if that system of making those data available is no longer in practice and no longer trustworthy, then what's the disposition of those data and their availability for people to look at?
I would argue that one of the things we do is, it is true that historically a lot of the data could only be collected by the federal government, but there's no need for that now. We have cloud-based approaches, you had FedRAMP, you could get authorization to operate. The federal government is, I would argue, no longer the right agent to design the collection and production of data. Might be relevant for setting standards across different states, different private sector, acting as a funder, but it's too slow and too centralized. And we've seen that. You said, yeah, there are ways to access the census and IRS data, but they're completely vulnerable to Doge, because all of that trust that we had with Title 26 and Title 13 protections didn't mean anything. So I would argue distributed control, but certified security, which is what the FedRAMP system sets up.
I think
I'm very worried, in other words, about the centralization of sensitive information and the
Yeah,
quality of data collection.
Angel, you were going to say something.
yeah, I was just gonna say there's data sets that are, mandated by law, that the federal government has to collect. So that, uh, for example, some of the Department of Education data sets, those just aren't collected at the state level. So there are other instances of that too, of data that's collected, that needs to be collected because of a law, that the federal government collects directly.
yeah, I
So
was just
yeah, I can't think of another example, but I do know the Department of Education has several of it.
yeah, and I'll just the example that comes to mind that I've been sort of using when I talk about this is COVID. At the very beginning of the pandemic, the COVID data was a mess. It was being handed out by counties and cities and states in all sorts of formats. The COVID-19 tracking project was born out of the need to collate all of that information in a timely way, and that was put together by volunteers, by like citizen data scientists and journalists. It was a tremendous amount of work, like a heroic effort from everyone involved. And then the CDC, though, it was in a position to compel the sharing of that data into a centralized location. And basically, the second that the CDC started doing that, the COVID-19 tracking project shut down because like it just was not sustainable for a purely volunteer effort,
Right.
to maintain that level of work that went into it. So I mean that's kind of one example that comes to mind. But
Yeah, and to your point, Emery, I just can't help but think of the probably hundreds of millions of dollars that go into something like the census or just any of these data sets and these HIPAA questions and so on. And of course, now we have questions about these privacy standards being eroded in ways that are concerning, but is that something that a volunteer army can do or something supported by philanthropy? It just seems very difficult.
So I don't think I completely concur. There's been tremendous investments and you kind of need some continuity, but that's what professional statisticians do. You don't keep measuring the same thing. Like the General Social Survey, the questions they used to ask about sexuality were informed in the 1950s. I was on the board of overseers with GSS. So, you have to be able to change, you have to be able to rethink because society and the economy is changing. The industry codes were developed, to describe a service economy, not an innovation economy. And 50 years before they were developed, they were developed to describe agriculture and manufacturing producing things. So we've always had to evolve, but there's nothing that says that you have to rely on the federal government to be doing that. And where I was saying was not that it should be volunteer. I'm an economist. People have to get paid for their time. Don't hate me for that. But what I said was that the notion of the feds acting as a source of funding, for example, under ARA, HHS had these competitions with states. They would pay 90%. States had to come up with 10%. That's where we got the standardized electronic health records. So there are lots of innovative funding approaches where you can identify a need, but having the collection and production of the data being centralized and in the federal system may not be the right approach, or may not be the only approach. I don't want to be too strong here. Jarvis is absolutely right, and some of the comments in the chat are exactly right. A combination of academic experts, that's what you said, Angel, the right questions being asked by the reporters, and philanthropic foundations can get the seed started and then invest in the ones that work out the best. I would just argue for a reset, the forest fire analogy.
And if I can be a bit of a devil's advocate here, or just poke at this a little bit, and my apologies ahead of time, my disclaimer. I just want to surface this question from Sandy Lamotte, who says, are red states also changing how they keep or report data, and how would this impact that method of gathering? And this idea that there's, flawed, admittedly, ways of that we categorize things, but is this going to become potentially another area with a lot of fracturing of what is the standard in that, scenario of, much more grassroots efforts?
Look at, if I could bear with me, it has to be an iterative process with continuous evaluation. What are the goals of the sparkling fountain? How far are we getting to what we're trying to measure? That and many eyes on the problem. I'm going to bang on census again. They imposed differential privacy on the 2020 census, which had a huge impact on small geographies and small demographies, and no one had a voice. And I don't think, and people are using that data because they're not aware. They think it's coming out for the federal system, so it can be trusted. Well, it can't. Not for small demographies, not for small geographies. So, and I think you'll find that you were talking about sex and gender differences. When differential privacy has been applied, it's going to be really noisy. So the moral of the story is, unlike my husband, not everything can be trusted, right? Not everything's perfect. He, of course, is wonderful in every way, including loading the dishwasher. But, many eyes and many judgments. And that's where the role of reporters is so important, because you want to get to the truth. So that's my response.
Yeah,
Sorry if I went on too much.
Yeah. And Michelle Maker asks, is missing government data available via FOIA requests? Any thoughts
Yeah,
on?
I can answer that one. So missing data as in if it's not published publicly, yes. If you know it exists, if you know it's collected, you can FOIA it. So that's one of the tips that I tell reporters: find the form that is used to collect the data. Make sure when you're FOIAing, you know it's there, and you can point to the details of why you know it's there, and whether it's publicly released or not, it'll still be FOIAble. If it's changed, old copies of the same data, that's a little tricky, because I don't know if in some cases it might be in the kind of rules of data keeping, that they'd have to keep historical data for a certain amount of years, but that's not always the case. But the one thing I would say is you can FOIA for any communications around the data set. So you can FOIA for anything that could give you information on why and what changes and who talked about it and all that. So not only is the data possibly FOIAble, but the information and the communication around it is also FOIAble. So that's something I would keep in mind.
We have a question from Rebecca Lindstrom. Is anyone keeping a list of the data sets that have disappeared or been altered? And I know, Emery, you're doing that with the CDC data set, but there's so many others, right? Do you have to just kind of figure out who's doing this in this volunteer army, or what do you suggest?
I mean, one of my favorite sources is the Data Recovery Project, which I think also organizes a lot of people working in this space. There are a number of trackers that people have made available. I don't know how complete everyone's lists are, but I think that across many of the organizations doing this, it's possible to put together a list of the most obvious ones. I think more troubling is when it's really just small changes to data sets or to the data dictionary or to the way things are coded. Those things are a little harder to detect. And I think there is this kind of fundamental tension as we try to track all those things, that it's possible to kind of go through with data science tools and kind of identify changes, but figuring out what changes are really meaningful and impactful, that's a little more difficult. And that's where I think the community needs to come in and kind of highlight the things that are urgent and of most urgent concern.
And
I'll just give this concrete example, like the end of term archive, like went in and, as I like to say, hoovered up like all of these websites. But you know, if you have terabytes of data on websites for the federal government prior to January 19th, but they're just sitting in an archive and you don't know what to look for, it's like looking for the proverbial needle in the haystack. And so that's where having people with particular things of concern to help direct what to look for becomes really important.
And I don't know if for all of you, there's some other places, and Jarvis, thank you for mentioning that resource that you would turn to. And also kind of in a similar vein, this question from Randy Loftus, who says, do we need a system for reporting when we find manipulation of data or narrative? And Randy says, my example, I found that a late 1980s NOAA report on a deadly flood now says moisture moved up from the Gulf of America, not the Gulf of Mexico, a change to historical document that future users are unlikely to realize. So I guess two questions. Are there places that you go to track the data sets that are being tinkered with? And if you yourself spot one, is there a place you should maybe go?
I would love for there to be like, I think that's what we need, right? The best I can, I don't know if anybody else has ideas, but the best I can offer right now is that there is we were discussing this at a conference recently, and out of that conference there is a Slack that is publicly open. It's mostly focused at journalists, data journalists. It is called news nerds, or no, news nerdery. It is a Slack that you can join, and we have set up a channel in that Slack called data preservation that you can also join. And that is where I think where I'm trying to organize some, more conversation about this. But no, other than that, I don't know if like an official, or not official, but a definitive source where you can go and report, data manipulation.
Okay. And I think we're coming up against our time, but let me just maybe, we have two questions here. I'll read out this one from Grace Abels, who says, LGBTQ plus fact checker here. Data on gender identity in the trans community was already minimal, and even more so with the recent changes to federal data. Yet there are many claims about this population that are made by public officials. Any advice on the best non-federal orgs that collect reliable data on this population? And are there any orgs stepping into this space and collecting data on this topic in the wake of recent changes?
So there are a few places that I think collect data. It's mostly survey data, and in some cases it's not nationally representative. But it does share, but the surveys do share some information on kind of lived experience of trans folks in particular. I think it's the Williams Institute at UCLA would be a good place to kind of start off with some looking for some data. That is where I worked before, but it's also where I learned how to be pretty creative with census data. So I would say start there. But there's also, I mean, beyond that, there are more surveys being done now smaller surveys that might be useful, but again, may not be nationally representative.
Yeah, there is a nationally representative survey of the transgender population. It's the TransPop survey by the Williams Institute and Columbia University and Harvard University. But also some of that money, some of the funding was federal funding. And so, it's unlikely that they're going to continue to be funded by the NIH. And so this is where it's really important to find alternative sources of funding through foundations and through the public that can support this kind of survey work. I also want to just note that, this question of like, For example, Emery noted the CDC websites that have changed the labeling of gender to sex. We should not delude ourselves. Most of those data sets only gave male and female as options for responses. So even if we think it said gender before, it didn't actually give gender expansive categories. And so, that work that we've been doing in the community to develop better questions, one that are more representative of people's lived experience, that has to continue. It's just harder now given the larger context.
I would
I'm gonna-
also
Go ahead,
not, I would also argue against using surveys as the main source of data. I think we need to be thinking of other sources of data, like administrative records and transaction data, and then use surveys to triangulate and infer, make the representativeness and the inferential validity. But continuing to use surveys as the main source of data is, I think, probably not wise.
Yeah, and I just want to flag this since Julie has brought this up a few times. I think this is where we need statisticians, data scientists who can think about how we triangulate across multiple data
Correct, yeah.
sources. But the work to develop the inferential frameworks for doing that hard work of data science and sort of thinking about data fusion, that needs to continue to be funded, and that's important. That work doesn't just happen by itself. So that's another area we have to think about.
Yeah, and I think one last thing about that is that in some cases, for trans folks, I would say this is the case now, that bringing to light administrative data that might identify people is also risky. So this also goes for data on immigrants or other populations where identifying that there's a place that you can count and you can talk about a certain population is also risky. So from a journalism perspective, that's an ethics question of trying to figure out how to approach any kind of small population that might experience harm from the release of certain data at a specific geography, possibly, or something like that. So.
Thank you. Really wise advice. I'm going to try and sneak in one more thing because I thought this was a really good question. This is a reporter who says that when meeting with legislative offices, the first question is usually asking about data. The trust is still there, but the access is not. And in the epilepsy space, we lost almost all of our public databases. And for us, the federal government was the only one providing that level of data and surveillance to show impact. Any advice on ways to access this critical data to show the impact of our community that we can show to offices to avoid legislative offices thinking that because the data is not there, it must not be a problem? And this obviously could apply to other areas in addition.
So my suggestion is we actually started to build something called the Democratizing Data Platform, where we use ML models to pull out mentions of data sets, right? So in scientific publications. So if you access something like Digital Sciences Dimensions, the 100 million publications, you search for the semantic context in which the researchers are citing a data set. You may not know the name of the data set, but you can see that they're using data. You then can find from the topic what data sets are being used by researchers to study a particular topic, like epilepsy or pediatric asthma or workforce or food security. And what we're finding is like only about 20% of the research that is on a particular topic like food security is actually using federal data at all. The other 80%, they're constructing and putting together. So that's, I think, a low-cost way of finding out the emerging data sets that are being used by the creative people who have an incentive to use data creatively is coming from.
Well, with this, I'm going to have to regrettably call our time. I want to say that there are so many other questions that I would love to ask these really wise people about. such as what all these federal changes mean for states and what we've learned from Florida when it withdrew from the CDC Youth Risk Behavior Survey. But perhaps we'll have to revisit this. Please, in a moment, we're going to share, in about 10 minutes, we'll share an evaluation. Please tell us what else you want to know on this topic, which I imagine we will revisit. I want to offer our thanks to Julia, Jarvis, Angel, and Emery, to the audience for all the great questions. I would also like to thank the members of our team who helped behind the scenes, content editor Ryan White, and the members of our communication strategy team, Emily Alpert Reyes and Nadia Lozano Murphy. We'll be, as I said, seeking your feedback, and we urge you to follow us on social media and to sign up for our newsletter, which includes info on future events such as our webinar on extreme heat and its impacts on health. We'll be holding that next week. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thanks so much for joining us, and have a wonderful day.